Today's episode of the StallSide podcast was brought to you by Rood and Riddle Veterinary Pharmacy.
Hey, Bart, how's it going?
It's good. Right as rain.
Yeah, that's good. Yeah, so great show today.
Yeah, very excited about today. You know, we had Dr. Fairfield Bain has just joined us at our practice in Wellington, and I couldn't be more thrilled. And more thrilled that he's on the program with us today.
Yeah, I know. Yeah, Fairfield's an interesting character, actually. He worked in a lot of situations, very high-level practice, and he's a very unique character in that, he's an internal medicine specialist for horses, but he also is a boarded pathologist. And so what I'm looking forward to today is hearing how he actually integrates his pathology knowledge into his daily practice, because you usually think about pathology as sort of being, well, you lost, right? And so we're trying to find out what happened to the animal. But I just want to sort of see how he brings that knowledge forward to help him in his daily practice and make better diagnoses.
Okay. Yeah, no, that's good. That's great. And he's incredibly intelligent, incredibly well respected, but you used the word twice. He's a character.
Oh, yeah. Fairfield's a bit of a hoot. So on StallSide this week, we're going to be talking to Dr. Fairfield Bain, internal medicine specialist and boarded pathologist, currently working at Rood and Riddle Hospital in Wellington, Florida. Dr. Bain, welcome to StallSide.
Well, thanks. Thanks for having me.
Yeah, thank you for taking time and being with us today. We really appreciate it.
Hey, Fairfield, tell us a bit about yourself.
Well, it's a funny thing, I've been at this for quite a few years, but I still think of myself as the farm kid growing up on a hog farm in Southeast Virginia. And that's really framed my mindset over the years, of how I chose the path in life and what it ended up doing and how I still see things today. So I grew up on a family hog and peanut farm in Southeast Virginia on the coastal plains of Virginia. It had been in my family for about 300 years. And I was the renegade. My father actually raised me to go do something else in life. And so the closest thing I could find was to become a veterinarian because I thought the guys that came to the farm were pretty cool.
Okay. So obviously you've had some major influences there besides your dad. As far as veterinarians go that used to come, is there anybody that stands out?
Yeah, there's a common name in our profession even today is a guy named Ryland Edwards, and his son is equine surgeon up in Connecticut, but his dad was the very first veterinarian that I ever worked for and one of the first veterinarians I ever met.
Really?
And, awesome gentleman, and framed up, made it the profession look really appealing, and framed up the opportunity of what being a veterinarian would be like,
Yeah, great.
That's great.
Yeah, so you've had quite an interesting sort of path as far as education goes. Do you want to talk a little bit about that?
Yeah. I struck off. I did my undergraduate work at North Carolina State University in animal science, and sort of, I think, a backup in case I didn't get into vet school. And then back in that day, Virginia didn't have its own vet school. So I ended up going to Auburn University to vet school. And when I was there, I transformed probably from being, back in that day, the James Herriot books, All Creatures Great and Small, were pretty popular. I probably saw myself like Dr. Edwards. I was going to do it all. But I got in school and I really liked the horses. And before that, my dad had always gone to the Derby. And so that'd been sort of my introduction to the thoroughbred world. And between the two things colliding, I ended up pursuing a path in the horse business. I ended up going back to NC State as their very first equine intern. And came down here to Florida, of all things, to University of Florida in the early 80s for an internal medicine residency. And then I jokingly say I went back after a couple of years in practice down here in Florida. I went back and did another residency at Kansas State University in pathology. And my dad kind of talked to me a little bit. He said, you're not making that much money. He says, you might want to go get a real job and sell real estate like your brother. But he said that tongue in cheek. But in the end, it became a positive thing. I managed to blend the two worlds together and make a career out of it. So,
gotcha. Yeah. Did any of the brothers stay on the farm, or did it?
My one brother did. Yep, he stayed on the farm, and just the transformation of, agriculture. He ended up stepping foot over into the farm and commercial real estate world. So although he lived on the farm, he made a living from doing
Gotcha.
other things.
Mm-hmm. Yeah.
Okay.
And
Okay.
we still had pine timber. And we got out of the hog business and leased out the agricultural land and kept the pine timber as a crop. So that's kind of how that worked.
Okay. Well, good. Still in the family then.
Yeah. No, that's great. It's good to have that tradition. So you're rather unique in your perspective. You sort of alluded to it with the medicine, the pathology. So how does that help you in your daily practice? I mean, what does that bring to the table that is unique?
Yeah, some of it's impatience. And my wife likes to tell me I need more of that every day. But I go scroll back to the farm, and maybe I should even throw up a picture of that place just for the heck of it. I don't know if you can see that when it comes up, but can you see that?
Not there yet.
Not yet. Oh, I think it's because I didn't click. There
you go.
Yeah. All right. So
Oh,
this comes from this. Okay. So that's a fat hog from the 1940s letterhead.
That is a righteous hog. That really is.
And the blend of this thing, let me scroll back just a moment, is that with the peanuts in that region, after peanut harvest, they'd turn those hogs out on the peanut fields. And this is way before confinement operations. And they would fatten up like that on the peanuts, and they were marketed as peanut fed hams. But just down the road from that farm, and you can see it's flat coastal plains, but just down the road was the state diagnostic laboratory. So I grew up understanding that the laboratory got used as a tool to solve problems. And I quickly learned, like in my residency days, that if I wanted to know something, I didn't wait around for the report to come back. I went to the laboratory and sat down at the microscope myself. And that was sort of, I talked about impatience. That's my impatience, but I really like having that as a tool. So over time, I sort of started as an internal medicine resident, and then I had mentors who were boarded in both internal medicine and pathology. And so they kind of guided me into, doing yet again another residency training. And I managed, as we're back up to what we were talking on, to fold that in. And everywhere I've been around the world, actually, I've managed to sort of integrate myself into clinical laboratory as well as into the internal medicine part of the practice. And so if I collect a trachea wash or a pleural fluid sample, and we've got some pictures for later on, I can go sit down at the microscope and study that a bit and come up with the pattern of what's going on, and turn around and go right back out to the horse and answer some questions pretty quickly.
Yeah, no, that's great. I mean, you have some case examples where you can show where that's been helpful?
So there's a couple examples. There's different scenarios that we end up diagnostically. This just turns out to be a horse that had a nosebleed, but it was a little bit more than a nosebleed. It also had a large plaque of ventral edema under the chest. And on the ultrasound, which you see on the left, there's just this huge volume of fluid in the chest cavity. You can see the mediastinal membranes floating in there. And so we sampled that and had this red fluid. And so I'm wanting to know what that is. And we have some perspectives of what it most commonly is, but then this one surprised us because this turned out to be an uncommon neoplasm called mesothelioma. And so I got that in about 10 minutes time instead of waiting for our laboratory to send me a report back tomorrow.
Wow.
And then a little bit more common, similar colored juice, from the chest cavity. This one also, you can see this old mare's thin, and she's got a large plaque of edema under her chest, and she had very red tinged fluid. But when we turned around and sampled it, this one turned out to be lymphoma, which is actually much more common than the other one. So in a matter of a few minutes, we had an answer. Now, for cancers in the horse, we're not quite there as far as other species. But some of these things are becoming, to some degree treatable. So as we learn more about these and how to quickly diagnose them, I think maybe, years hence we get a little better at treatment part of it. But the real answer is that we save somebody time by coming up with a diagnosis fairly quickly. You know, there's some other things we do, like tracheal washes. I think a lot of people are familiar with tracheal washes and from foals on up to adults, you know. And so the example on the left is a foal with Rhodococcus pneumonia, and you can see the little purplish blue dots of the bacteria, and all the material there is what pus looks like under the microscope. It's ruptured white blood cells, neutrophils, and smeared chromatin. And so that's a piece of the puzzle. Now, that clinical scenario probably didn't take a lot of guessing, but you can get a pattern, say, change the scenario to an adult horse. If they're pretty sick, we may more likely see something like that. Whereas we see some that had still been spiking fevers, but their ultrasound, for example, doesn't match up. And this one, the image on the right, is a collection of macrophages, some of them having multiple nuclei that we see when the horse is starting to clean up that lung process. So both of these scenarios were tools that gave us some information about what's going on in that lung in a pretty quick period of time. And being able to take that sample and walk down the hall and sit down at the microscope in the lab and do that has made it fun, actually, because we're problem solving, you know. And then one last one was a couple different scenarios. We see a lot of horses in South Florida with asthma, and that's what the sample is on the left. These little raspberry-looking cells are eosinophils that are usually involved in some degree in some kind of allergic process. But then we see a sample on the right that came from a horse with a really huge honking cough. And it turns out this thing was pastured with about 20 donkeys, and this thing had lungworms. So we use these different scenarios to sit down and really quickly come up with some answers. So I just thought that would make a few interesting stories behind, you know, how this fits into your everyday world, blending pathology with the clinical medicine.
Yeah, no, that's a huge advantage to be able to just walk in and sit down and look at that rather than wait for reports.
Oh yeah, absolutely. Yeah. I mean, and then, yeah, it's, but it's a continuum, right? I mean, we deal with that sort of all the time, but to be able, as you say, to be in a more timely fashion, because, you know, talk about the lab as a tool, and that's exactly right? You're looking for information to actually allow you to make better decisions. And, you know, you have the unique combination where you can actually cut down the time component of that. So that's actually really important, because some of these things you talked about, they're not necessarily that time sensitive, but I'm sure you could tell us situations where it really was time sensitive to actually be able to, you know, make that call that quickly.
Yeah. And, you know, it's a bit like a lot of things we do. The fact that these images are sitting on this computer is because they're digital captures. And so we've got a really nice microscope with a digital camera sitting on it, and we can share these images all around the world, or somebody can vice versa send us images, and you know, we can communicate back and forth about what's going on. So it adds another little piece to our ability professionally to exchange information with owners and veterinarians, and it makes it, and plus they're pretty cool looking pictures.
Yeah, no, we live in an incredible time with the technology.
Yeah,
it's helped our communication so much.
Yeah, we really do. And so, yeah, I know you're primarily in a clinical role at the moment, but you know, this would be, you know, part of an outreach, and as far as, you know, advising colleagues and on patients to sort of say, hey, send me some images and I can give you a bit of an answer. Yeah, I mean, that'd be a great tool.
Yeah, absolutely. I love that. And that's exactly this. This makes it fun is anytime you can go looking at some of these samples and pull out a piece of information to help somebody manage a patient much better, then that makes it, you know, all of that much worth it.
Yeah. So where do you see the profession going? I mean, there's a lot of talk at the moment, and a lot of debate as to, you know, where the future of equine veterinary medicine lies, and especially with, you know, artificial intelligence and the applications of technology. I mean, you've touched on a little bit there. What's your opinion on where the profession is going? I mean, how are these things going to help practicing equine veterinarians going forward?
Yeah, that's a really important line of thinking, right? I'm old fashioned is I still think that our basic skill is understanding the animal, and that I'll always go back to the physical examination of the patient is like the first place, because how we think like you mentioned artificial intelligence. There are programs now that can scan and analyze these slides and tell you a little bit about what's on there, but it probably not yet is able to tell the difference between the horse with asthma on the left and the horse with lungworms on the right.
Mm-hmm.
That takes you delving into the story and the history with the owner. And there are lots of pieces to this that the human mind still needs to engage this information. So they may well be able to tell you, oh, those other ones were lymphoma cells. So those programs we're going to see that. So I'm talking specifically pathology, but it's very active in the world of pathology as far as image analysis. We already see it in our other imaging, right? Radiology and other types of imaging. Artificial intelligence is already engaging, and especially in human medicine, the analysis of those structures, anatomic structures, is already pretty common. And we see that in pathology. And so it's almost like the little touch screen ECGs we see advertised on TV. That stuff has migrated so fast to the patient side. That's the other thing of this. It goes from sitting in a distant laboratory somewhere to where some of these things may be able to be done almost patient side. And you know, it's back to that, how quick can you get the answer? That's our world, right? Is we want things now instead of tomorrow. So I see a lot of it being used that way to speed up the process. But I will always say that we still need to use our thinking minds to apply it properly, so we're not sent down the wrong avenue. I think everybody's probably familiar with trying to type out, at least I am. I'm not as technologically savvy sometimes on my phone, and the autocorrect feature might have me send you a really bad message. Mm-hmm. And so it's what is entered into the program.
I've got some great stories about that. But.
Yeah. I'll try not to text you the wrong message, but I'm guilty of that, changing my words. But I think that's it, is how we use it. We still have to think of it in a practical manner. Does that information that you get back fit all the story in your physical exam? So we still need the person. I think veterinarians' great value is that they are trained in the knowledge of an animal anatomy, physiology, and how to do a physical exam and put a lot of those pieces together. And you get all these great images back, and that's probably going to be, as you said, come pretty fast, where you can almost get it on your phone. And some other type of imaging device to help you get to a microscopic image. So at least in pathology, I think I see that kind of thing. To answer your question, I see that coming.
Yeah. Could we get you to swap your screen back? Would that be okay?
Certainly. Yeah. No, which one do you want?
We want to see you.
Yeah.
Yeah. You didn't see me. Nice.
One of the things that we've seen change over the years is we have to be a little bit careful in the training of our veterinarians that this AI thing is one thing, but even our technology that we have, not reaching for technology so quick, but using the power of observation and a stethoscope and, you know, just your fingers and your hands. There's so much to that. And that's one of the things I do with young veterinarians, is get them to slow down. Don't grab the ultrasound so quick. Don't grab the x-ray machine so quick. Use your eyes, use your hands, your ears.
Yeah, well, the way I heard it was like the diagnosis is made between the ears, right? And so, yes, all this sort of stuff can sort of lead to information overload, but technology is a good servant. It's a bad master. And if we're just running away to try to say, oh, let's get another piece of information, and then it's paralysis by analysis, right? I mean, I think when people come to see us, ultimately they want us to make a decision based on the information, not let the information sort of roll over the decision, and then we're sitting there and can't make one. Probably. So I look at it.
I can give you good examples of that is things have to unfold sometimes in the clinical story, right? You know, you might start out and go, oh, and then you've immediately skipped in your mind to jump down a diagnostic path. You get a little bit more information coming out over the next several hours or next day, and then you change direction when you realize, oh, this other piece of information. So I race a lot of times to a quick decision making because of these.
Yeah.
The instantaneous lifestyle will make us overlook some important pieces of diagnostic information sometimes that we have to fold in. So Bart, I can't agree with you enough, is that the physical exam, putting your hands on the animal, watching an animal it's not, that will never go away. Yeah. I don't see it. I think that's so critical in our world still.
So we won't be seeing RoboVet just yet.
Not just yet.
Yeah. Hey, Bart, we're safe.
Yeah.
No. But I did not grow up thinking I was going to stick my arm up an animal's butt on many days and have, green armpits. But here we are. So we still do that.
Yeah. Well,
yeah. Well, I was actually, as I was checking some bears this morning, I did say out loud, there has to be a better way.
Yeah. Yeah.
Well, but that's, when did that come about? And that's not yet 100 years old. So,
yeah. Well,
I understand that we do it now. Who was the first guy that did that? And
I know
it was a good idea. It worked out, which is a lot of things we do in veterinary medicine. You go,
yeah,
this works, but I wonder who the first guy,
yeah,
who thought of this was. It was a really bad idea then, and it worked out.
I really think we probably need to look it up. But I am big on history. This is my 42nd year, which I'm shocked to think that went by that fast. But I still love it. And I hope that younger people love it as much as I have. And that's my wish for the profession. But history has changed so much in that time frame. I was out of school before reproductive application of ultrasound was going on.
Yeah.
And it really didn't come out. It started burgeoning out in France and England in the early 80s, and then took a couple of years later before it was in North America. And even ivermectin and banamine, things we take for granted today. And these young folks that come out of school, I think what's lacking a lot of times is understanding the time course of history in the professional world and how things evolved. What we consider dogma today was way different, maybe even 20 years. 20 years seems like yesterday some days, but the history of things we do and why we do it, I think is always very interesting.
No, and you have it. You mentioned the James Herriot books, and just reading those, you get a perspective of how many tools that we have that he didn't have, and yet they still did a great job.
Yeah, that guy, it was awesome because he made so many people want to be vets. He made laying around in the mud delivering a lamb sound glorious.
Yeah,
that's about right. Well, I mean, Fairfield, that's a great tour of your career, and it really is a good insight into how you've actually applied your pathology training to medicine, which sort of seems like the back end of it talking to the front end, right? I mean, pathology is usually looked on as the destination, but you've managed to make it part of the journey, which I think is actually a pretty unique thing to be able to do.
Yeah.
Yeah. Now, and you talked about the destination part. We occasionally do necropsies. I mean, a lot of times in our world, the diagnostic laboratories are so efficient, and especially there in central Kentucky, one of the best ones in the world, and it's right down the street, But occasionally we get called to do them in the field, and then that does become another useful tool. So that part of pathology still is there, and it takes the right setting and that kind of thing, and occasionally I've done stallions that for whatever reason were not able to make it to a laboratory or that kind of thing. But the other part of what we looked at in these slides today is the fun part every day, where you answer a question in a live animal that helps you make some difference.
Yeah, no, that's a great comment. So, yeah, well, I mean, Fairfield, it's been wonderful having you on the program. I mean, welcome to the practice.
I was gonna say, we're so thrilled to have you in the family. It's really an honor that you're a part of the team.
Yeah,
we appreciate it.
No, it's great fun, and I'm enjoying it tremendously. So, thank you guys for having me on the podcast.
That's a wild group down there. You're hanging out with.
Yeah, like all families, it has its characters, That's great.
It's truly a joy. Every day has been fun. It's a little different adventure, which is my word of the adventure.
Yeah, adventure. Yeah, that's great. So that was StallSide for this week. We were talking to Dr. Fairfield Bain, very storied veterinarian with a strong background in internal medicine and pathology. Is currently at Rood and Riddle Equine Hospital down in Wellington, Florida. See you next time.